Sleepwalking, somnambulism, is a type of sleep disorder. Look at this picture, shows that sleepwalking behaviors causes. Look at this behavior and pathophysiology. A detail going on. Introduction. Sleepwalking, also known as somnambulism, is a sleep disorder that involves performing activities usually associated with wakefulness, such as walking, talking, eating, or even driving, while in a sleep state. It primarily occurs during non rapid eye movement sleep, specifically in the deep sleep stages. It is more common in children than in adults and tends to decrease with age. Though usually harmless, sleepwalking can sometimes lead to injuries or dangerous situations. Definition. Sleepwalking is a type of parasomnia characterized by a state of partial arousal from deep sleep, resulting in complex motor behaviors performed while still asleep. The affected individual often has no memory of the event upon waking. Etymology. The word sleepwalking is a compound of sleep and walking, describing the act of walking while asleep. Somnambulism comes from the Latin word somnus, sleep, and ambulor, to walk, meaning walk in sleep. Types. 1. Simple sleepwalking include mild activities such as sitting up in bed, walking in short distance, or mumbling. 2. Complex sleepwalking involves engaging in more elaborate behaviors like cooking, driving, or attempting to leave the house. 3. Aggressive sleepwalking characterized by violent behavior or emotional outbursts during sleepwalking episodes. 4. Sexosomnia, sleep sex, engaging in sexual activities while sleepwalking. 5. Sleep related eating disorders involves eating food while asleep without recollection upon waking. Causes. Several factors may contribute to sleepwalking include 1. Genetic predisposition, family history of sleepwalking. 2. Sleep deprivation. 3. Stress and anxiety. 4. Fever in children. 5. Sleep disorders. Example obstructive sleep apnea, restless leg syndrome. 6. Use of sedative medications, alcohol or drugs. 7. Neurological conditions, example epilepsy, head injury. Risk factors. 1. Family history of sleepwalking or another. Parasomnia. 2. Regular sleep schedule. 3. High levels of stress or anxiety. 4. Fever, especially in children. 5. Certain medications, example sedatives, hypnotics, antipsychotics. 6. Mental health disorders, example depression, schizophrenia. 7. Sleep deprivation. Complications. 1. Accidental injuries, example falls, cut, burns. 2. Increased risk of violent behavior. 3. Impaired daytime functioning due to poor sleep quality. 4. Disruptions to family members' sleep. 5. Legal consequences, example sleep driving incidents. 6. Worsening of underlying sleep disorders. Pathophysiology. Sleepwalking is a disorder that occurs during deep sleep, NREM sleep, and is characterized by complex motor behaviors such as walking and talking without conscious awareness. The pathophysiology involves multiple neurological and physiological factors. Here is step by step breakdown. 1. Sleep cycle disruptions. 2. Incomplete arousal from deep sleep. 3. Dysfunction in brain networks. 4. Hyperactivity of the sleep promoting system. 5. Genetic and neurochemical influences. 6. Triggering factors. Certain triggers increase the likelihood of sleepwalking episodes, including sleep deprivation, increases slow wave sleep, stress and anxiety, fever and illness, disturbed sleep, homeostasis, medications, example sedatives, antidepressants, alcohol and substance use. 7. Behavioral manifestations. Sleepwalking episodes can range from simple movements, sitting up in bed, walking around, to complex activities, leaving the house, eating, even driving. The person may have open eyes but a blank expression and attempt to communicate with them often failed. No recollection of the event upon waking up. 8. spontaneous termination of episode. Episodes typically last for a few seconds to several minutes. The person may either return to bed on their own, wake up confused, be guided back to bed by others. 9. Post episode state. Individuals may feel groggy, disoriented, or fatigued upon waking up. Unlike seizures or psychiatric conditions, sleepwalking does not involve full conscious awareness during the event. Signs and symptoms. 1. Sitting up in bed and appearing confused. 2. Walking around while asleep. 3. Performing routine activities, example dressing, eating. 4. Speaking incoherently. 5. Black or glassy-eyed expression. 6. No memory of the event upon waking. 7. Difficulty waking up during an episode. 8. Engaging in dangerous behavior. Diagnosis. 1. Clinical history, detailed patient history and eyewitness report from family members. 2. Sleep study, polysomnography, measures brain waves, heart rate, breathing and muscle activity. 3. Video monitoring, captures sleepwalking episodes in a controlled environment. 4. Epworth sleepiness scale, assesses daytime sleepiness. 5. EEG, electroencephalogram, rule out seizures related disorder. Nursing diagnosis. 1. Risk for injury related to unconscious nighttime activity. 2. Disturbed sleep pattern related to sleepwalk episodes. 3. Anxiety related to fear of harm during sleepwalking. 4. Impaired social interaction due to embarrassment about the disorder. 5. Risk for self-directed or other directed violence. Management. 1. Ensuring safety, lock doors and windows, remove sharp objects and install alarms. 2. Improving sleep hygiene, maintain a regular sleep schedule, reduce caffeine intake. 3. Cognitive behavioral therapy, helps manage stress and anxiety. 4. Pharmacological therapy, use of medications such as benzodiazepines or antidepressants in severe cases. 5. Patient and family education, inform family members about how to respond safely. Treatment options. 1. Behavioral therapy helps identify and modify triggers. 2. Medications, low dose benzodiazepines, or antidepressants for severe cases. 3. Hypnosis, used in some cases to modify subconscious triggers. 4. Relaxation techniques, medication, breathing exercises, and progressive muscle relaxation. 5. Avoidance of triggers, managing stress, avoiding alcohol, and ensuring adequate sleep. Psychosocial medicine. 1. Cognitive behavioral therapy (CBT) helps reduce stress related sleep disturbances. 2. Family counseling. Educate family members on handling episodes calmly. 3. Support groups provide reassurance and shared experiences from other sufferers. 5. Mindfulness meditation encourage better sleep patterns through relaxation. 6. Lifestyle modifications, healthy routines, stress management, and proper diet. Prevention. 1. Establish consistent sleep schedule to reduce stress through relaxation techniques. 3. Create a safe sleeping environment. 4. Avoid alcohol, caffeine, and sedative before bedtime. 5. Ensure adequate sleep to prevent sleep deprivation. In conclusion, sleepwalking is a complex sleep disorder that can pose risk to both the affected individual and those around them. While it is generally benign, severe cases may require medical intervention. Proper management through behavioral therapy, medication, and preventive measures can help to reduce the frequency of sleepwalking episodes and improve overall sleep quality. Increased awareness and education about the condition can help individuals and their families handle episodes safely and effectively. Have a nice day.